So we've got Health Secretary Matt Hancock here. So first of all, Matt, why are you in Yate today?
Well, I've come to Yate because Luke and I have been working on the improvements to healthcare here in Yate since I was first Health Secretary, and Luke Hall has badgered me more than almost anyone in Parliament to improve services locally, so I thought I'd better come and have a look and see what's happening.
And we're outside of the Yate MIU, obviously, where opening hours have extended. There's X-ray services 7 days a week now. That's a result as of funding and campaigning, which is the great work that people are doing here in the area.
Well, we've been working very hard. We've put in the extra investment into the NHS, and the thing that people are interested in, though, is not the big billions of pounds numbers nationally. What they care about is how is the NHS going to improve for me? And I care deeply about the NHS. It matters to me in the same way it matters to everyone else in this country, because it's always there for you. And this minor injuries unit is now open longer, it's more accessible. We've already been hearing from people here in central Yate about how it makes their lives easier.
You talk about the billions that are being spent, obviously, nationally. Labour announced their plans today, and that was £5 billion more, I think, over the next 5 years or so. Yourself, you're quoted as saying that will cripple the government. Here in South Gloucestershire, how do you think if people vote Conservative, they're going to benefit?
Well, we have a clear long-term plan for the NHS. It includes just under £34 billion extra over the next 5 years. The thing about Labour's plans today is they're proposing a 4-day week within the NHS, which is the thing that would cripple the NHS, because which day would it close on? Instead, we have a long-term plan. We need more nurses, we need more doctors, and we need more facilities, the bricks and mortar, and we're investing in all three.
Now, also, just moving across South Gloucestershire to Thornbury, which is also part of the constituency here, there's also been a bid, I think it was in December 2018, that was for £10 million worth of funding to help restore Thornbury Health Services over there. That was rejected in December 2018. You've now thrown your support behind those plans. Why have you changed your mind on that?
Well, that bid, I thought it was a good bid. It didn't quite make it over the line, but it's clear that it needs to happen, and we've got extra funding now going into the health service. The thing is, you need the strong economy, and you need the economy to be expanding. We've got record numbers in work. That means more people paying taxes, which means we can fund the NHS better. And that means that over time you can back, as Secretary of State, I can back more and more of these projects. Couldn't back it that time, very much hope to in the near future.
And that's it. Residents are obviously going to really be wanting your reassurance. There's been quite a few setbacks with that. Can you provide your assurance that that will be taking place over the next couple of years in Thornbury?
What I can say is that it is it's on my desk, and there's no better campaigner than Luke Hall to get it over the line.
I think the thing here as well, because that the government is now committed to overseeing Thornbury Health Centre, and you kindly wrote to me a couple of weeks ago confirming that. It's really good news. The government's finally working with me, gripping this issue, and we will make sure that is absolutely priority in South Gloucestershire.
Cheers, thank you very much for your time.
Okay.